If you've struggled with CPAP, you know the frustration of trying to force a one-size-fits-all solution onto a very personal problem. I'm Dr. Jordan Weiner, an otolaryngologist specializing in the surgical management of obstructive sleep apnea. As a clinical researcher, I have also been active in improving Inspire therapy, including helping develop key changes to the surgical procedure, but also in helping define which patients are more likely to benefit from Inspire therapy. The Inspire system establishes a communication between your chest and your tongue. The current Inspire model 3150 senses breathing and stimulates the hypoglossal nerve that controls tongue movement. By stimulating this nerve, it causes the back of the tongue to move forward. When the tongue moves forward, it also pulls the palate forward and increases tension in the sidewalls of the throat to open the airway. The Inspire system includes a pulse generator, which is about 2 by 2 inches in size and about ½ an inch thick. It's implanted under the skin in the right side of the chest. We can place it almost anywhere in the chest region and tailor this location based on patient preferences. A stimulation collar is wrapped around the hypoglossal nerve in the neck. It's connected to the generator with a stimulation lead or wire. Inspire was the first FDA-approved system to stimulate the hypoglossal nerve. It has been in use since 2014. The pivotal STAR trial showed an average reduction in breathing pauses of about 70%, a reduction that was maintained during the 5 years of follow-up. About 86% of patients continued using Inspire after 5 years. Selection criteria are specific to ensure the best possible outcomes. First, Inspire is used to treat moderate to severe obstructive sleep apnea with an apnea-hypopnea index of 15 to 65 for Medicare and 15 to 100 for non-Medicare plans. Second, you must have tried and been unable to tolerate CPAP or BiPAP. Third, candidates should have a body mass index or BMI less than 35 for Medicare and under 40 for non-Medicare plans. Finally, you cannot have a concentric collapse pattern on drug-induced sleep endoscopy because Inspire is less likely to be effective if you have concentric collapse. After reviewing your history, I perform a comprehensive examination of your nose and throat with you seated and lying down to evaluate your anatomy. I have developed a specific measurement called supine pharyngeal width, or SPW. This measures the distance from one side of the throat to the other. By measuring this side-to-side space of your airway while you are lying down, I can objectively predict if the Inspire system will be likely to open your airway. We then perform a brief sleep endoscopy called drug-induced sleep endoscopy, or DISE. This endoscopy is performed while you are sedated at an outpatient surgery center. I look to see how and where the walls of the throat collapse. This is performed to confirm you don't have complete concentric collapse at the level of the soft palate. The way we perform this surgery has changed significantly, and I was proud to be part of the team that developed the 2-incision approach, used worldwide today. Previously, implanting Inspire required a more invasive 3-incision procedure. I helped develop a less invasive procedure that moved the breathing sensor to the upper chest, so the 3rd incision in the lower chest was not needed. Today, we've refined it even further. The generator in the latest Inspire 3150 model now detects when you breathe. This means that no separate breathing sensor is required. When implanting Inspire, the 1st incision is made in the neck. The hypoglossal nerve is located and the stimulation cuff is placed around specific branches of the hypoglossal nerve. The 2nd incision is made in the right chest. The small generator with sensor is placed in the upper chest and sewn in. A stimulation lead is tunneled under the skin from the cuff to the generator. Once everything is secured, the incisions are closed. Like any surgery, there are risks, including infection, hematoma, or tongue weakness. There is also risk of malfunction of the implanted components in the future. Following the surgery, most patients experience mild swelling and discomfort for about 1 to 2 weeks. You must avoid strenuous activity or heavy lifting for 2 weeks to allow the implant to heal firmly in place. The device is not turned on immediately to allow for complete tissue healing. After 30 days of healing, Inspire is turned on. Working with your sleep medicine doctor, you will find your functional threshold, the level where the tongue moves but you remain comfortable. You will gradually increase the stimulation level so you are comfortable as your tongue muscles adapt. Once you're doing well with Inspire therapy and have been using it for a while, you'll need to have a sleep study to make sure that your sleep apnea is adequately treated. There are two things to consider when choosing Inspire. First, the battery within the generator will need to be replaced about every 10 years. Second, you can have an MRI that uses a T1.5 scanner, which is the most common. However, as of this recording in early 2026, you cannot have an MRI that uses a T2 or T3 scanner. This may change in the future. I have performed nearly 600 Inspire implants as of the recording of this video. While success rates in most published studies are typically in the 75% range, my personal success rate is over 90%. 90% of patients who I have implanted with Inspire are successfully treated. These patients feel more rested and have a much lower risk of health problems due to the sleep apnea. We've come a long way from the early days of 3 incisions and more implanted components. By using the SPW measurement and the streamlined 2-incision technique, we can offer a more precise, less invasive path to waking up refreshed. If you believe you meet the criteria we discussed, the next step is a formal evaluation. For more information about Inspire, as well as my practice, please go to weinersleepsurgery.com.